Hi, I'm Dr. Krishna Ramavath. I'm the Gynecologist and also the lead colposcopist working at AL-HILAL Manama, and I have a 23 years of experience. March is a month of HPV awareness and also International Women's Day. I wish all the women out there a happy International Women's Day. This year's theme 2023 is Embrace Equality. So we renew our commitment in this digital world to embrace gender equality. Women's Day is all about women empowerment. And in this regard, I want to bring about cervical cancer awareness and talk about HPV and also colposcopy. Starting from December 2017, the cervical cancer screening program is changed. The traditional pap smear is replaced by more sophisticated HPV DNA testing as a primary screening for cervical cancer. Both tests are done in the similar way in the doctor's office. The doctor introduces a speculum into the vagina and collects some cells from the cervix and sends to the laboratory to check for cervical abnormalities. So, traditional pap smear is really a good test, so it identifies the cellular changes, but unfortunately, pap smear is only 50% sensitive, whereas the sophisticated HPV DNA looks for the HPV virus which causes the cellular changes, and it is 90% sensitive. Because of this high accuracy, we do HPV primary testing every 5 years for women of 30 to 64 years of age, and whereas pap smear, we call women for every 3 years to check out for the cellular changes. What does it mean to be HPV positive? HPV infections are very common and they are seen in almost all women and men who are sexually active. And body actually clears off the HPV infection with cellular immunity, and there are about 200 strains of HPV virus, and most important in them are 16 and 18. These are cancer causing strains and they are called oncogenic. So what does it mean if you are HPV positive? It doesn't mean that you are having a cervical cancer. It doesn't even mean that you are having an early form of cancer. It only means that you are high risk for cervical cancer because there are abnormal cells on the cervix and you need to be continuously monitored and treated. So what happens when there is an abnormal pap test or abnormal HPV DNA, or when the HPV DNA test reports as positive? So it is then we send you for a colposcopy. Colposcopy is a procedure where the colposcopist, such as a doctor or one like me who has been trained in colposcopy, has a closer look at your cervix to identify the abnormal cells. These abnormal cells are called CIN, cervical intraepithelial neoplasia. This doesn't mean that you have cancer, it only means your cells are abnormal. Colposcope is a lighted, magnified instrument which looks at your vagina and also the cervix to see any abnormal cellular changes. While doing the procedure, colposcope stays outside the vagina and then clicks the picture so that we can see the images in detail. Colposcopy is done as an office procedure and it is relatively painless, and it doesn't need any anesthesia. So during that time, sometimes we also do colposcopy guided biopsies. It is a see and treat approach. If there are any cellular changes, with your consent, we do treat the abnormalities at the same sitting. Colposcope guided biopsy results usually take 2 to 3 weeks time, and 4 out of 10 women have normal results. That means you do not have any abnormal changes. This happens even when you have abnormal screening pap test or HPV test. That is because colposcopy is a more detailed look at your cervix and the results can be normal. So you can come back for the screening every 3 years or 5 years depending upon your age. And 6 out of 10 women may have abnormal colposcopic results, and the cells changes can be notified as cervical intraepithelial neoplasia CIN or CGIN, cervical glandular intraepithelial neoplasia. And even these abnormal changes doesn't mean that you have cervical cancer. They only mean that your cells are abnormal for these changes and you need more intense monitoring and treatment. So what happens after colposcopy appointment? You can leave the hospital as early as you are ready. So you can even have your usual daily activities. You might have a slight cramp like a menstrual period or slight brownish discharge, or there may be small pain and usually a Panadol might be sufficient during that time, but we ask you to avoid sex, swimming, and also no tampons until the discharge or the crampy pain is subsided. And every woman recovers differently, and what is right for someone else may not be right for you. So you take adequate time for your healing and you can come back for the results. So if your colposcopy results or abnormal pap results or HPV DNA results cause anxiety to you, we are there for you. If you want an expert advice, do meet me at AL-HILAL Manama, and I am Dr. Krishna Ramavath. I am the gynecologist working here, and I will be available 1 to 9 p.m. So have a wonderful March and happy International Women's Day. Thanks for watching.